another video in the bathroom. Okay, so now that we're done with month 2, we're going to talk about like doctor's visits, procedures, that kind of stuff that you can expect in the month 2. And the biggest thing is seeing your doctor if you haven't already, pretty important, or midwife, or whomever. Meet with your doula, start looking for those. If you're on your own, that's great. I always recommend someone, no matter how you choose to do your birth, someone that understands birth in any way, like truthfully, down to like medically, be with you and be a partner. That's not your partner unless you are very, very confident in what you're doing, because you never can truly prepare how your delivery is going to go, how your labor is going to go, and there are situations that you need to be taken to a hospital, period. And this is a very life or death situation. And this is a good month to start figuring that out, especially because now you can, all the risk rates are starting to go down. Every month has its own risk, but things are going, you got a baby in there, you know what I'm saying? So you should really have your back as well as babies. And then if you choose to do a time ultrasound, that typically happens by the end of month 2. They normally do that around week 7, 8, 9, those kinds. Or those kinds, I would say those time. But yeah, other than that, you really aren't getting anything. You may get a blood test to confirm hormone levels, and that you are pregnant outside of a urine test. But typically the urine test that they have at the doctor's office is much stronger than anything you can get over the counter. So they really rarely do that. And you usually don't go in for blood work until after your first appointment or after your first ultrasound. But obviously every doctor is different, every situation is different, and you may want to do your blood work instead of doing the ultrasound. So those are just things that can be happening during this month. But yeah, that's really it. There's not a whole lot going on in month 2 when it comes to doctors, and it's necessary. But your typical pregnancy, where you're not looking for a midwife, you're not looking for a doula, you don't want to do it at home, you want to do it in a hospital setting, just go see an OB. You're going to be meeting your doctor or meeting with your OB, and then you're going to get your time ultrasound typically within this month. And, it may push to month 3. There's really no difference at this point, but it just depends on your OB's preference. There's nothing that you're going to miss if it's happening at week 12 versus week 8. But that's it. And if you guys have any questions, please comment below.